Hello guys and welcome back again to my channel. Hello guys and welcome back again to my channel. Um yeah, in case this is your first time of seeing me, I'm an Akan MD and I make lifestyle content. I make content about YouTube too and medical school content. I'm so sorry for my background, right? So I decided to go on this live because I realized that with the current happenings in Nigeria, like it has actually taken a toll on me, right? Um, I don't know. I actually have some videos that I'm yet to edit and all of that, but like I said, because of everything that has been happening, and I've just been quite distraught, right? In case you don't know, in Nigeria, a lot of things have been happening. First, there was a kidnap, yeah, at KB State of 25 girls. 25 girls were kidnapped. I mean, these bandits, as they call them, went into this secondary school and kidnapped 25 girls, shot the vice principal dead, and left some others injured. As if that was not even enough, a church in Kwara State was invaded by these bandits in quotes, right? So they went in and they stole and shot some of the church members too. Or is it the fact that a lot of things have been happening, a lot of kidnapping? So basically, I don't know, it has actually like kind of taken a toll on me and affected me quite negatively because you know these things, I don't know, they have a way of having an impact on you. All right, so like I said, I have some videos that are yet to be edited, and I honestly don't know when I'll get to editing them, right? But I decided to like go on this live, right? I'm going to be talking about pathology on this live. I'm going to be talking about most that you would find helpful, at least would help you, navigate this pathology class. um I think I'll let me activate my chat so that I can literally see your messages. Um, yes, I think. Uh, okay, I think everyone, you're free to send me your messages, your questions, and all of that. So basically, I was just saying, like, um, the whole event and happenings that have been happening in Nigeria has kind of taken a negative toll on me and has affected me quite negatively. So there is that. Then as well as other things, right? So now I'm just going to give you guys like highlight things that I feel like are important that you should know as regards pathology, right? So first off, I would say pathology is divided into four different pathology. It's quite noisy around here, so I don't know whether I'll close my um let me see if I can close my window. So yeah, for pathology, it's divided into four parts. So we have histopathology, we have hematology, we have chemical pathology, and medical microbiology. So these are the four parts basically that we have for pathology. And out of these four parts, I think the bulkiest of them all is histopathology. In fact, that is the bulkiest of them all. Histopathology is the bulkiest of them all. Although there are other parts, there's hematology, there's chemical pathology, and there's medical microbiology. So for us in our own school, like what actually gave us like tough time, not because the course on its own was tough, but just because of the peculiarity surrounding the department as regards the people taking this. I would say like the people taking this are like I'll just now looking back, I'm like, okay, maybe they are more like perfectionists, so they wanted a certain or expected a certain standard of knowledge that we were supposed to know. So it was quite tough. Their MCQ was like the toughest, and that was hematology, right? So I'm just going to go over each of them and tell you some of the tips and tricks. Subsequently, I'll release a longer video. But until then, I think I should just do this live, which is going to be on my channel, and anyone can watch it whenever. Now, first off, I would start off with saying for hematology, one of the things that would help you is having understanding of the course, like in terms of baseline understanding. So when I say have understanding of the course, right, I'm talking about the basic knowledge, the fundamentals of hematology. okay, if you're doing leukemias, you should know the basics of what leukemia is and some of the etiological, although most of the time etiology is unknown. However, some of these risk factors contribute to it. Like you should know a bit of pathophysiology, like you know that it's usually from a clonal stem cell that usually results in these leukemias, right? So basically having an understanding. Now, one of the things that helped me, because I don't think I understood like hematology so much until I started watching this man, Medicosis Perfectionalis on YouTube here. His videos are really, really good. His anemia videos are over 100, if I'm not mistaken, 100 plus on red blood cells. Then white blood cells too is much, like 100 plus. Then platelet too is much. But with this number, a lot of people just got discouraged and all. But the truth is, his videos are not long, right? His videos can range from 3 minutes, 5 minutes. I think his longest videos will be like 15 minutes or 30 minutes. So basically, his videos aren't long. So there are things that you can actually finish once you put your mind to it, right? So okay, so these are like videos that you can actually finish once you put your mind to it. So I would say that you should binge watch his series. He has a funny way of talking, like this, a bit of sarcasm in what he says, and it makes it beautiful, right? So watch all his playlist. That's what I did. I binge watched all his videos, and that gave me like a general understanding that I can build up in, right? I understood, okay, this is what hematology is about. These are the core fundamentals of this course. And okay, then I can now inculcate my class lecture notes with the knowledge that I've gotten from his video. Like even when it comes to classification of acute leukemias, especially for yes, classification of acute leukemias, when we're doing AML and ALL, he classified it beautifully. That is Medicosis Professionalis on YouTube. He classified it beautifully, and it was from him I heard that the M3 phase, right, can be treated with all trans retinoic acid with arsenic, popularly known as vitamin A. So like it was beautiful watching some of his videos. Like it was, you kind of learn from it, right? So I would advise you to binge watch Medicosis Professionalis for hematology, right? I understand that not everybody is a audio visual learner, but like I would encourage that you read that. Then we also have Hofbrand. I think every school reads Hofbrand for hematology. Hofbrand undergraduates, because in preparation for our MCQ, because of how difficult it was, I had to start looking at Hofbrand postgraduates. That was a different book entirely. It was tougher to read because you know that I'm an undergraduate now, so like reading postgraduate books, I eventually gave up. I just stopped, and I'm like, okay, if they're going to be bringing out things that are my outside what they taught, right? If they're going to be bringing out things that are outside what they taught, I might as well just focus on other parts of the exam. I know that theory will be within what we have been taught, and I know that steeplechase, which is our practical, will be within what we have been taught. It will be either making of, because of our practicals are steeplechase, they will not necessarily ask you to prepare a blood film, but you'll be doing things like checking PCV. They will give you a PCV sample, and they'll ask to, like, what is the PCV using the hematocrit reader. You'll be asked to look under the microscope. Like there will be like leukemic slides. There are normal slides, and there are leukemic slides, and there are abnormal slides. So basically they will bring abnormal because they will not never none of their slides are going to be normal. They're not going to give you a normal blood film. They will either give you a leukemic sample, or they would give you a sample with red blood cell pathology. So you might be looking at iron deficiency anemia, you might be looking at megaloblastic anemia, usually from vitamin B12 or folate. You might be looking at a film with I know these are the major one, iron deficiency, sickle cell. Yeah, I know they have sickle cell film, and because it is one of the major problems that we face here in Nigeria, I know they like bringing out sickle cell films. So these are some of the things that you'll be looking at. So basically, as you go for your practicals, please pay attention. So like for me, like I told you, like I found that the MCQ was quite difficult. It was beyond our scope. It wasn't what we were taught and all of that. So basically what happened was I just switched my focus and I was like, okay, I will do my best in the MCQ because every mark counts. But I'm not going to kill myself over the MCQ when there's the theory and there's the. So you just have to be realistic with yourself. But going forward, I think they understood and they were able to make modifications. Because how will, out of a class of over 200 plus, only 10 people, or like only 10 or thereabouts is passing? That means your questions were really difficult and out of scope. So basically, I'll just start off by telling you hematology is not hard, to be honest with you. It's a very beautiful course. I think I fell in love with it. I fell in love with it. I love talking blood, right? It was quite exciting and interesting. So going with that mindset that it's not difficult, and hopefully it's everything will fall in place. Like I've given you a recommendation. Another thing is that you can do past questions. So I know I used to do USMLE questions because I know their hemato-oncology section is really strong, right? You can do that. Test yourself actively when it comes to hemato-oncology because it's a very major. Like for me, another reason why I had to pay attention with it was because I know that it's a heavily tested section in USMLE exam. So basically that was one of the those are some of the tips that I have. Then another one is let's go to histopathology. Histopathology happens to be the bulkiest of all pathologies. Some people beg to differ because microbiology is also bulky. So I would say that the both of them, they are like the bulkiest pathologies. I still say histopath takes, I don't know, sharp. But I still feel like histopath is the bulkiest. But anyway, people will beg to differ. Histopath for me is like very bulky. The books are huge. The recommended text is Robbins and Cochrane. If you're using Robbins and Cochrane, because there's Robbins and Cochrane, which is what we know as the Baba Robbins. Then there's basic Robbins pathology, right? That is student friendly version. That is the Mama Robbins. Then there's the students. This is smaller Robbins, pocket Robbins. That is the children Robbins. So basically, I'll just advise that go with the students, the basic Robbins, the student one, the basic Robbins pathology. I know I did read some things there, but aside that, we had extensive class notes. Our class notes were very extensive. Our slides were very comprehensive, and you waste so much time even reading the slides, right? So we didn't really have that much time to be referencing Robbins, except maybe we just wanted clarification, or when we wanted to we have a presentation to make, and you have to read detailed. You have to make sure your readings are very detailed. That's when we went to Robbins. But the truth is, for our school, histopathology wasn't a major problem. Like, they were very nice people, they were beautiful people, they were very kind, and they really wanted you to pass. They were people that actually wanted you to pass. So basically, if you show up for classes, you come for classes, you read their class notes, you do what you are asked to do. Maybe their practicals, you pay attention to the ports because they will teach you different gross pathologic ports, right? So basically, these are like cut section of diseased organs. So they had that. Then there was also microscopic slides. If you pay attention, they will describe it for you. Like, just pay attention and do what you're told. If you're asked to, learn this spot, please learn it. If you're asked to read these slides, please read them. Like, learn it. Just know the slides for yourself. Know that if you're looking at Hodgkin lymphoma, you're looking for the owl eye appearance. If you're looking at bucket, it's more of a starry sky appearance, basically with an inflammatory background, or basically that's it. Then if you're looking at things like fibroadenoma, you're looking at slit-like space compression of the acini. If you're looking at, so basically do all of those things for the practicals, because practicals are where you can get 100 marks. And for histopathology, for our school, they didn't really bother that much. If you got 100, I don't think they will give you 100, but just know you can get 90 and 90 and above. You can get 98. You can get as high as 98 for them. So basically, just pay attention in their practical sessions and do what you're told. For their lectures, right? for the, sorry, I'm a bit distracted. So for their lectures, their slides, like I said, for our school we had comprehensive slides, so we just had to read that, right? I know there was, like I said, and Robin's textbook was just a book for reference, like whenever we just wanted clarification or something, or we have a presentation to make. If you can read Robin's, it's a beautiful book, well written. And going further, please, when you start, know your general pathology. Know your general pathology and know it well. Like, I don't know what you will do, but read your general pathology like your life depends on it. If you have any questions during this interaction, you can send it in the chat box, or if you just want to say anything, let's talk. Just type it in the chat box. So when you're reading histopathology, the rule is general pathology is key. Know your general pathology like your life depends on it, because I've seen, even in our examinations, right, they pay heavy reference. I don't know whether it applies for other schools too, but for our school, they put a lot of reference or heavy concern on general pathology. And even in your viva, once they see that maybe you are not very strong, maybe you're feeling or something in the orals, they are quick to switch to general, because they believe that general is the fundamental and everybody should have an idea of the general pathology. Like, you should know what sorry guys, I would go live again. I don't know, I just had a break in transmission and I'll be back.